Hello, good morning everyone. Welcome back to Flavors of Deccan. Today I'm with Dr. Roya Rozati ma'am. Again, I'm going to ask some important topics and we discuss everything about IVF, ICS and treatments, challenges, everything with Dr. Roya Rozati ma'am. So stay tuned. Let's dig into the topic. Thank you. Good morning ma'am. How are you doing?
Good morning, Aisha. How are you?
Alhamdulillah, I'm good
Good to
ma'am.
see you today.
Thank you, ma'am. Ma'am, today I have brought a very trending topic, IVF.
Very important topic.
Yes, ma'am.
For the patients and for those who need IVF, we need to give this knowledge to them so that they will go with the full open mind, with the full knowledge. And I'm very, very grateful to you and also to the patient who listening to this video clip, where you are putting lots of effort to give this information to the public who are in need of this information.
What is IVF?
Very important question. IVF means in vitro fertilization. Normally, as per the physiology of the body, the fertilization occurs in the body because normally during the time of the intercourse, the spermatozoa coming from the cervical canal and the oocyte come from the tube, and then they meet in the mid segment of the tube, that is in vivo. In vitro happen either in the petri dish or in the test tube. That is why called in vitro fertilization, means outside the body. Test tube baby means it is outside the body. It doesn't mean that it is other than husband. It is the husband semen which is used. That misconcept should be removed from the people's mind.
Ma'am, next question. Who needs IVF and who needs ICS? Indications.
Yeah, very, very important question. IVF is for all kinds of tubal problem. If there are tubal pathology and there will not be any problem with the fertilization, IVF is the answer. But ICSI, as I mentioned to you, for all kinds of the male problem, male factor problem, whether it is a azoospermia, whether it is a severe oligoastenospermia, whether there is a necrospermia, whether there is a basically all kinds of the problem or sexual impotence, which is basically we have a doubt about the fertilization power and fertilizing capacity of the sperm. With regards to the motility, with regards to the count, this is the ICSI is the answer. Even in severe cases of endometriosis, when we have a doubt about the fertilization, because with the conventional IVF, we may not get any good type of a embryo, so it is ICSI can sometimes be very helpful. Or in the PCO cases, in the severe different type of PCOD cases, or if there are any doubt about fertilization like immunological or unexplained infertility, these are kind of cases, or repeated IVF failure, ICSI has to be done without any doubt.
What are the challenges patients have to face?
Challenges patients, they must know. Other centers, what they do is they will say less price and they will fail. So 1 cycle, 2 cycle, 3 cycle, the whole money is gone. But the patient who come to this center, they get the best price and they get success in the first attempt. They don't need to go for the second attempt. In our center, maximum 1 or 2 cycle, no third cycle. I'm very surprised. I see patients, other center, they go roam around 5 cycle, 6 cycle. That is not right. That is basically, it is unethical with our patients who have a limited budget. We have to be fair with them and we have to review the case. If patient doesn't get success in 1 cycle or 2 cycle, we have to just review the case. We should know the cause of the failure, whether there was any problem with the patient or whether there was any hydrosalpinx, whether there was any infection, PID. All those things has to be addressed and has to be rectified before we take the patient to the third cycle. But I don't see this scenario here. And I see that patient with multiple IVF failure, they come to us and they get success.
Recent success story, ma'am. I have seen so many, but for our followers, I'm going to ask you.
This is a recent success story.
Oh, mashallah.
This is the patient was told by everybody
Oh.
All the IVF specialists in Karnataka, in Tamil Nadu, in Andhra and Telangana. South India, they told her you will never get conceived. She was a case of a stage 4 endometriosis. We have done the laparoscopy, we have done the adhesivolysis, we have treated her PID, and we did the IVF with her own egg, and she got blessed. That's why she gave me this momentum. And I'm very glad whenever I remember that IVF success and ICSI ART success is very challenging. But if you put your heart and soul, and if you are totally committed, and you have a passion for success, and you see each and everything, and you do a proper workup, success is inevitable. There is no doubt.
It's really
And this
nice.
interesting case, one cycle only we got success.
Mashallah.
And I'm very grateful to God, and very grateful to my patient, and grateful to all of you.
Ma'am, I have seen so many worldwide patients are coming from you, not only from Australia, UK, US. Even recently we got questions from USA. How did you feel, ma'am? Not only in India, you are, mashallah, say, worldwide you are famous for IVF queen.
See, Aisha is like that because they are needy patient. They are needy patient. They have to feel their pain. They have to understand their problem. They have to know the cause. They have to know the root of the problem. We should never feel that we are great. We are nobody. God is the greatest. God is the greatest. But as a scientist, we should have an expert knowledge, and we should do the best thing, and we should even not ignore simple hormonal problem or any infection. We should not allow it. Then you can get a success. It does not matter that how I feel. It matter how our my patient gets success. That matter to me. I had a case from Gurgaon, Delhi, where everybody think that they are getting the best success in India. No, they are not the center of excellence. We are the center of excellence.
Excellent.
This particular patient, she was a software engineer, and every week she had to book a flight and to come to Hyderabad and meet me. But then she decided to go for IVF because she saw me, and then she got faith. And then she resigned her job and she stayed here for nearly 1.5 years till she got pregnant. She got triplets, and then she got blessed with 2 baby girl and 1 baby boy. One sentence she asked me, "Doctor, why are you taking my hormones, my E2, my LH, my progesterone so many times? Where in Gurgaon I had my IVF previously and I didn't get success, but nobody checked." I said, that is the reason we get success here. Because we do monitoring, careful, strict monitoring for all the patients who are undergoing ART. Proper workup, detailed workup, and then that's how the success is.
God bless you more and more, ma'am. Stay blessed, and inshallah we will meet with other topic, ma'am. Thank you.
Thank you.